welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher of Modern Healthcare and Vice President of Crane Communications. Thank you for joining us today. Joining me is Dr. Joanne Conroy, President and CEO, Dartmouth Health. Joanne has been recognized in a number of Modern Healthcare's recognition programs, including the 100 Most Influential People in Healthcare, Top 25 Women as a Luminary in 2019, and the Top 50 Physician Leaders in Healthcare. Joanne, thank you so much for joining me today.
Thank you for inviting me, Fawn. It's great to be here.
So you are a physician leader, and there are more physician CEOs today than in years past, right? Are there advantages to having a physician at the most senior levels of leadership in a hospital, or especially in an academic institution like Dartmouth? If so, what are some of those advantages?
I mentor and advise a number of physicians that aspire to leadership roles. And this is my advice that I give them. You get a little bit of a pass as a physician. You haven't taken a normal path to health system or hospital leadership. However, you still have to deliver the same way that a non-physician has to deliver. You have to make sure that there's a level of financial stability, that you're creating and executing on a strategy, that you're putting the right people on your team, and you're engaging your organization. You know, some of this is probably from experience and maybe some of people's kind of the characteristics they bring to the job, and some of it actually can be learned. But I tell physicians that if they don't deliver on really the important things for that health system, regardless of their degree, they will not be successful. And I think sometimes that's sobering for a lot of physicians that get serial degrees, but aren't able to get the experience that they really need in order to be successful in the roles that they aspire to.
Great. Well, great advice. So I understand you have recently launched a project, ECHO, educational series aimed to educate healthcare providers and the public about the effects of climate change on health. So I have two-part question for you. What are you hoping to accomplish with this outreach? And do you have other sustainability initiatives underway at Dartmouth Health?
Our ECHO program around the impact of climate change is not our first one. Actually, Sally Kraft, who heads our population health, which is actually the very traditional population health that's caring for the communities, started an ECHO project at the beginning of COVID to educate people across New Hampshire and Vermont about how to deal with COVID. And trying to really not just get to the institutions, but to private practitioners that were distributed over the very wide geography that we deliver care in. So they've decided to do this around climate change as well. Make no mistake, climate change is not something that's off to the side that has nothing to do with healthcare. Climate change has a lot to do with healthcare. I remember reading a headline from I think it was Seattle when they had a horrible heat wave because of climate change. And it was, how are we going to prevent in the future emergency rooms being overwhelmed with people from heat exhaustion? And I thought, well, that's the problem right there. You're expecting the health system to do things that's really a social challenge that requires government and communities to also be involved, because it's not like you need to build more emergency rooms. What you need to do is understand the impact of climate change and anticipate the fact that those elderly citizens who are alone in non-air conditioned spaces without fans are going to be an extremis unless you get them to cooling centers in advance or buy them fans. Or so climate change is not just a medical intervention. It is, part of how we live our lives. When you think about the forest fires in California and the impact on air quality, Climate change affects our health, and we have to attend to it as kind of a health-related issue. Um, However, it kind of starts at home. Like, what are our sustainability initiatives? And as we're building our new patient tower, we actually have invested 10 million extra dollars in it to make sure we are as energy efficient as possible. And that goes from insulating it to selecting the appropriate windows to having the appropriate lighting that is triggered when people enter and leave a room. All the things that are actually going to save energy. We also have a big sustainability initiative around waste. So we are working with our community leaders who are just as interested as we are in medical and non-medical waste, and how we can actually move to a zero waste initiative across both New Hampshire and Vermont. And certainly people that move here love the environment, and they are just as concerned as we are about the impact of climate change.
Thank you so much for your work and for your efforts in advancing sustainability in healthcare. So it's a very important topic for modern healthcare. In 2022, we actually just launched our ESG educational series. Would love to talk to you more about this in the future. And for the audience, please tune in. Please check Modern Healthcare for more information and content on ESG in healthcare. So Dartmouth Health is the largest private employer in New Hampshire, which positions you to have a significant impact on community health and potentially health inequity. How does this inform your policies and initiatives?
Our population health group that's led by Sally Kraft has had a focus on health equity for a long time. New Hampshire is one of the whitest states in the country, but we do have areas of the state which are becoming more and more diverse. When we look at the communities that we serve here in the upper Connecticut River Valley, our issues are really poverty and access to care because of poverty. Poverty that is significant enough that people don't have transportation. They don't have a car. They don't have access to healthy food. There are things that you wouldn't expect we'd be dealing with, but we do deal with it in order to really make sure that the communities actually address their healthcare needs. So in Grafton County, where the Academic Medical Center sits, we have some of the best healthcare metrics in the country. And yet you move one county over, which is 15 miles away, they have healthcare metrics that can rival the worst in the country. A lot of that is poverty, some of it is education, and some of it is access to care. And those are things that we work with every single day. I think for all of us, equity is the name of the game as we move forward. And as we look back at COVID, we know, who's been the most vulnerable and who has had the greatest impact. And this won't just be about COVID. It will be able to apply to diabetes, stroke, heart disease, et cetera. And the focus is putting our resources in the place where they can actually improve those metrics for that broad community.
Great. So I know that a passion of yours is advancing women. So you co-founded Women of Impact for Healthcare, a group of female executives from across the healthcare industry who believe that healthcare for all will be improved with more women leadership. Can you tell us a little more about this group, this program? And I'm proud to be a member, but love to hear you talk to the audience about it and where you've been able to start making an impact.
This is kind of call to action for anybody that's listening that if you feel passionate about something, um, don't wait till you retire and don't wait till you think it's the right time. Just kind of jump in and do it. This is my second not for profit that I've started. And I started it in 2013. Although my first experience with what's called creating your legacy, or now we call it your indelible mark, but it's making a commitment to create an impact. That started when I went to a program in 2011. You know, all of us go to leadership programs and they give us skills, they give us networking opportunities, but this was very unusual. They said, you are at the peak of your influence. What are all of you doing in order to create an impact? And are you living into the future that you want to live into? Or are you held back by your past? And I was in the room with a bunch of people from Microsoft, Google, and Dutch Oil Shell, and nobody was in healthcare. But when I started to think about the impact I could have in healthcare, I said, you know, the system doesn't work for people. And what if I got a number of women together and we started talking about what we needed to do to change it? I applied to the Robert Wood Johnson Foundation and they gave me a starter grant for about $95,000 where we pulled the first group together. And now I think we're on our 8th or 9th cohort that will actually come to join the group. And, you know, first we wanted to, you know, fix healthcare, but, you know, that's a pretty big order. And we had to chop it up in just smaller bites. Yeah. And we talked a lot about, you know, creating the kind of changing the context of healthcare for patients, for providers. But, you know, what we landed on was actually increasing the number of women leaders in healthcare. Yeah. They said, okay, let's do this because we know this is actually necessary because the number of women in CEO positions are small across the country. And we know it's going to have an impact. So we started adding more women to the group. We were some of the founders of the Carol Emmett Fellowship Program, which now continues and trains about 23 to 25 women leaders a year. We also are supporters of the Equity Collaborative, which looks at our practices to create equity in the workplace. And we spend a lot of time promoting other women in leadership roles and trying to make sure people get sponsored, get recognized, get acknowledged for their contributions. And the best, you know, gift of all of this is to see women actually rise in positions in their organizations or go to other organizations. It was funny, the first few years, and I think it still holds true, about 50% of the women actually changed their job after they went through the program because they realized that they weren't doing what they were passionate about. Yeah. And there are a lot of times we just do what's put in front of us because we're pretty good soldiers. But we have to remember that we need to do things with a purpose and for a purpose. And that purpose should be in service of your kind of personal legacy statement or what you want to create an impact on, and or the group. And the group actually talked about societal health last fall. Mm-hmm. And a lot of it had to do with climate change, Fawn. A lot of it had to do with equity. And it wasn't just healthcare. It was, you know, what's the environment we're actually living in and what's the impact of that on our health, both mental and physical health.
Well, it's been truly an honor and such a rewarding experience to be a part of Women of Impact. And so thank you for your leadership there. Thank you for driving, change, helping to drive change and advancing women in leadership in healthcare. So on that, to that extent, from your experience, what are some unique qualities that women bring to healthcare leadership roles?
When I observe women and men in leadership roles, I actually observe the difference in how they approach things. I find that women are often better listeners. They're actually use a little bit more positive inquiry, but they really do active listening, and they're listening to understand.
Mhm.
I see that in some men as well, but I see it much more commonly in women. I would. The second thing they do is um, they often approach the problem both with logic, but also with empathy and authenticity.
Mhm.
And that's a great trio for communication. They need to be in balance. You can devise the best solution in the world,
Mhm.
but you have to begin with empathizing that the person's coming to you with a problem and be authentic and transparent about what you know and what you don't know. But
Mhm.
then apply some logic about how you're going to solve it. And you need to have all three. I see a lot of men that use just logic.
Right.
That's necessary, but it's not sufficient.
Right.
And actually, I've started asking all of our team to think about how they communicate to make sure there's that balance of authenticity, empathy, and logic.
I love that. Authenticity, logic, and empathy. Love it. Love it. Joanne, it has been such a pleasure and an honor to speak with you today. And thank you for taking the time out of your busy schedule to be with us.
Well, you know what, Fawn? Your leadership has been incredible at Modern Healthcare, and you have been an inspiration and a role model for many women across the country. And I want to thank you for your just unflagging determination and energy to elevate women in healthcare. So thank you.
Well, that's so kind. Thank you so much. Means so much to me coming from you, my role model. Um, Thank you, everyone, for joining us today. As always, I look forward to seeing you again on the next Fridays with Fawn. And so please don't forget to mark your calendars for our 2022 Women Leaders in Healthcare Conference, which will be on July 14th and 15th in Chicago. Until next time, thank you very much.